Carpal tunnel syndrome is a prevalent condition that causes pain, weakness, and numbness in the wrist and hand. This condition happens when one of the three main carpal tunnel nerves, the median nerve, is compressed or strained while passing through the hand. It is difficult to diagnose and treat carpal tunnel syndrome correctly. The diagnosis is usually made from a history of symptoms, X-rays of the wrist, and the hands and wrists tests to assess their state of health. However, several factors can cause the condition, including age, poor muscle tone, bad posture, repetitive motion, and trauma to the wrist joint. There are many different treatment methods available, and these are discussed below. One of the easiest ways to get relief from carpal tunnel pain and prevent it is to exercise the arm regularly. This is easy to do as long as you balance working on both the upper and lower body. This means doing some stretching exercises, aerobic exercise and weight training. In some cases, carpal tunnel surgery may be needed. There are various forms of surgery for the condition, and an experienced specialist does this. A pin is placed in the wrist, and then the tunnel is narrowed to allow the nerve to pass through. This is known as a pin or tunnel procedure, and it takes less than 2 hours to perform. Another way to learn how to stop carpal tunnel pain is to make sure you are using the correct hand grips at all times. While some people can use their dominant hand without any problems, others are more susceptible to pain due to a weak grip. When learning how to stop carpal tunnel pain, it is important to know how to properly use your forearms. These are the muscles that help support and hold the wrist bones together and cause pain. The muscles and tendons that support the wrist bones should be kept in a relaxed state at all times. Learning how to use your forearms correctly means making sure they do not squeeze the muscles or tighten the wrist joint. The main causes of carpal tunnel include overuse and underuse of the muscles. If you overuse your muscles, the condition will become worse. Overuse will make the area more prone to pain, but it will make it even more painful if you underuse your muscles. It is important to keep the forearms relaxed at all times during the day and when sleeping. The wrist is not meant to be held at a sharp angle during sleep as it will result in pain as the carpal tunnel muscles are not supported. The other major cause of carpal tunnel is a weakness in the wrist's tendons and muscles. Carpal tunnel can be caused by a variety of factors. You could have an injury to the tendons or muscles, an infection, diabetes or poor posture. One prevalent thing is the wrist being misaligned. This means that there may be excessive pressure on the wrist joint, causing the tissue to get stretched out of shape. The muscle tissue that is affected will become more swollen and tender. There are some things that you can do to reduce the risk of developing carpal tunnel. These include avoiding repetitive movements that could stress the wrist joints, such as typing on a computer or lifting heavy objects. Taking regular warm showers and massages is also essential for preventing carpal tunnel. A good massage can help ease the tension in the area, and it will also help to relax the muscles of the wrists. When learning how to stop carpal tunnel pain, you need to do everything you can to protect your wrist joints.